Now this.
Recording now. Hello, everybody. Kia ora and kaya. My name is Sue Roberts. I'm a mental health nurse, and I will be speaking about what it means to be mentally healthy. So we all walk around and we appear to everybody else, our friends, our relatives, perfectly okay. And yet within, we may have stuff like depression, we may have felt suicidal, we may have people that actually committed suicide, dealing with that, even a death of a loved one or a friend, eating disorders, schizophrenia, post traumatic stress syndrome. The list goes on and on. But without further ado, I have Linda with me, and she is a mental health nurse. And I would just like to say hello, Linda.
Good evening. How are you this evening?
Mind your own business.
So I got into mental health nursing because I wanted to understand my family better. I think I was probably lucky enough to dodge a gene or two in my family, and I wanted to understand those around me better so I could maybe help improve their lives as well as my own.
Wow, that's pretty amazing. And that'd be interesting to know whether other people in our profession actually get into mental health because of some of those very similar reasons. So, can you tell us a bit about your family dynamics?
Sure. So I grew up in a family in Western Australia in the 70s and 80s, and I have two younger twin sisters and two parents, so the 2.3 kid family. So and Dad was worked a lot. He was always at work, and Mum was the one that stayed at home with us. But my mum had depression my life growing up, and she also had an addiction to benzos because back in those days we didn't do talking therapy. Doctors just gave a script, and there was a whole series of what we called housewife junkies in the 60s and the 70s in Australia.
I think we actually still do that though, Linda.
So at least they do the talking therapy. It's not just writing a script anymore.
But I've probably got a little bit to say about that. I don't totally agree with that, having been a nurse for 47 years. I don't actually think that anything's really changed, except it's much harder to get benzos. Anyway, we're not here to talk about that. We're here to talk about your family. So tell us a little bit more about your family.
So basically, as a kid, nowadays we would call it neglect. I basically did whatever I wanted as long as I was home by the time the street lights came on. So I had a pretty free childhood, really. But looking back, it was probably more neglect because I was often hungry as a child because cooking wasn't on the top couple of things of my mum's things to do in a day. But Sundays was always looked forward to because that was Dad's day off, and we'd often have a really good dinner because he would cook.
Oh, wow. So when you talk about getting into mental health, and it was to do with your family. So tell us a little bit more about that, helping you to understand the family dynamics. Can you just expand on that?
Sure. So, look, I think as we become older and realised in the world that our family wasn't that normal, I, for one, ran away from my family. I was 15 when I figured out that I had feet and I was female, and off I went because I just wanted to run. I wanted to see the world and look for better things. But both my younger sisters stayed at home with my mother. And I think that's environment plays a big part, not just genetics when it comes to mental illness, because the longer you stay I guess, an environment that's toxic, the more damage is going to come out of it. And both my sisters developed substance abuse issues. And I'm not saying that I didn't party hard in my 20s and things like that, but both of them, well, Kathy ended up, my younger sister got schizophrenia out of several episodes of drug-induced psychosis
Oh,
using
wow.
meth. And my other sister has just recently got a unit but has been homeless after breaking up from her marriage as a 50-year-old woman and living on the streets
Oh,
from
wow.
alcohol.
Oh,
Yeah.
wow.
And in comparison, I'm, got a university qualification and I own my own home.
Yeah, that's fantastic. Good on you, Linda.
Mm.
So what, like, when you look at your siblings
Mm.
and you look at you, so they stayed at home with your
Mm.
mum and you ran away. So what can you see now as an adult as the difference between your siblings and yourself?
I had control over my life. I controlled who came in it. I could make decisions, I could make choices, and I always wanted better. I guess I wanted to make the world a better place. I wanted to take my knowledge and understanding of trauma, I guess childhood trauma, and but I had to spend my 20s probably healing from that childhood as well. And during that time, I travelled the world and ended up in New Zealand, of all the places, to play women's rugby. And then I was not even there a year, and I became pregnant with my son at 34, and my whole life turned
Oh,
around.
wow.
Yeah.
And just talk a bit about that, having your life turn around, pregnant, living in New Zealand.
Yeah, well, look, it was now or never, I guess. Like I thought, if I'm ever going to have a kid, now's the time. And all of a sudden, I got ambitious. I used to talk to my son every night when I was pregnant how, I would get us our own home and I would go back to school and use his brain for good. And I managed to do that by the time he was 7 and on my own. I'd split up with his father when he was only young, 2 or 3.
Yeah. So he was living in New Zealand?
Yep. So, and I ended up coming back to Australia when my son was about 2. And my dad was really supportive and helpful, and I put myself through school. And yeah, I was an enrolled nurse for many years, and then I did my conversion and didn't graduate uni till I was 40. But hey, I got there
Wow.
eventually.
Wow, that's fantastic. Man, you've crossed off a few boxes in your life. That is amazing. So when you look, so how are your parents now when they look at you? So if you take your mother, how does she see you?
Look, it's really difficult to answer that question in the last 10 years. I would say before 10 years ago, my dad is in end stage dementia at the moment. I actually came and saw him on the way here this evening. But my dad taught me work ethic. He said to me, Linda, no one's ever going to give you anything in your life. You need to work for it. And he instilled that in me at a very young age. I have not worked since I was 15 years of
Oh,
age.
wow.
Yeah. My mum, she's proud, but mum is always been one of these women. I think if she was born in my generation, she probably would have chosen not to have children. But of course, she came from an era where, you had to get married and have children, and that was your lot in life. So I'm very glad I was born in the era that I was, that I could make my own money and do what I want to do with my life and not have to be dependent on a man.
Oh, wow. That is fantastic. So, what are you doing at the moment? Where are you working? Or not necessarily where, but what are you doing at the minute?
So I'm back in the child and adolescent arena, which is really good. I guess one of the things I was thinking about this earlier, one of the things I learnt when I went to university, one of the first things was every time a mother in a family has education, the whole health outcomes of their family improves exponentially. So, and everybody, look, I see generational trauma, I see generational poor parenting, I see generational addiction issues. But there has to be, and it's always a mother, I don't know why, but it's always a mother that's got to change the trajectory of their family going forwards and to look at things differently. I worked for CAMS probably 10 years ago, and the one thing I learnt bringing up my son was not what to do because I didn't have those parental role models, and kids learn how to emotionally regulate by the role models in their lives. So I learnt what not to do for CAMS, and this time around with CAMS, I'm trying to teach mothers how to do things differently. And it can be really difficult because these bad habits become lifetime habits sometimes that you have to break.
Wow, that's amazing. I think there's a lot of things that need to be done, but that's pretty amazing. So, how do you see your future?
So my part-time retirement plan is to therapise my dog and go out into the community and, take him out to the aged care and disabilities and things like that. But I can also see a teaching role when it comes to Nursing as well. I'd like to teach younger nurses coming through that it's not just enough to have an education by university. You need to actually have some life experience,
Totally
or else
agree.
you're never going to
Yes.
be able to have the empathy that you need to work with families.
Yeah, I totally agree.